Hello everyone, I'm Dr. Talal Zahid from the Department of Periodontology at King Abdulaziz University, Jeddah, Saudi Arabia, and I will be presenting our systematic review entitled Systematic Review of Experimental Gingivitis Induction Methods, a Methodological Variation and Their Impact on Inflammation Progression. It was conducted in collaboration with my colleague, Dr. Amal Jamjoom. Gingivitis is a reversible inflammatory process of the gum caused primarily by plaque accumulation. It will lead to swallowed gingival tissue, profuse bleeding. And when this etiological factor is treated, the inflammation is resolved, as we see in the slide. The experimental gingivitis model, first introduced by Low and colleagues in 1965 in a classic study that was done on 12 dental students. The gingivitis was intentionally induced under controlled circumstances to better understand how inflammation develops and resolves. Over the years, several modifications to the model have been proposed, varying in duration, plaque control cessation, monitoring parameters, and our aim was to systematically review these variations and assess how they influence the inflammatory outcomes. Here representing the prisma flow diagram summarizing our search and selection process. We screened a large number of studies from major database, then we removed the duplicates, excluded papers that did not meet our inclusion criteria. The final number of the study provided a comprehensive overview of a different induction method, participant populations, and assessment parameters. In the heat map, we illustrate the risk of bias assessment across the included study. As you can see, some studies demonstrated a high methodological rigor, while others had limitations such as unclear randomization or incomplete reporting of clinical outcomes. Recognizing these biases help to interpret the variability seen in the inflammatory responses across different studies. In conclusion, our review confirmed that the experimental gingivitis model will induce reversible inflammation. However, variation in the induction duration, design, and participant characteristics significantly affected the reported outcomes. We recommend future study to adapt standardized protocols and to stratify participants based on the host response variability. Ultimately, understanding these patterns can contribute to more personalized preventive strategy in the periodontal care. Thank you for watching this video abstract. For further correspondence, you can contact my colleague Dr. Amal Jamjoom. We hope our findings encourage greater standardization in experimental gingivitis research